Hi, welcome to the SVU First Virtual Conference Vision 2020. My name is Melissa Kraft, RVT, from Emory St. Joseph's Hospital in Atlanta, Georgia. Today I will be presenting a poster case study on duplex ultrasound imaging of the iliac veins with penile prosthesis implant. First, a little bit about iliac vein compression. It can be characterized by unilateral leg swelling, discomfort or pain, and can often result in deep vein thrombosis. Vein compression can be a result of physiological factors, such as compression from the iliac artery, or it can be caused by mechanical factors, such as a penile prosthesis implant. For this case, this is a 63-year-old male with a history of prostate cancer, ultimately resulted in erectile dysfunction. He underwent surgery, having an inflatable penile prosthesis placed in the right retropubic space. Over the course of about 4 months, the patient presented with right lower extremity edema post-placement of the IPP. Over the course of about 8 months, the patient actually underwent 2 revisions for his penile prosthesis. The first revision took place about 5 months following the initial placement. It had been determined that the penile prosthesis had a malfunction which prevented the reservoir from deflating. So they removed the original 2-piece inflatable penile prosthesis and replaced it with a 3-piece prosthesis in the same retropubic space. Post first revision surgery, the patient continued to have right lower extremity edema and also an additional symptom of nightly edema occurrences. At this point, the patient was referred to our vascular lab and a duplex ultrasound was ordered. We used color and spectral Doppler, as well as utilizing a combination of a linear 9.3 megahertz and a curved 5.1 megahertz transducer. During the duplex, we imaged the inflatable penile prosthesis reservoir, as well as imaging the right external iliac vein, the common femoral vein, and proximal femoral veins for patency and flow dynamics. The duplex findings determined that when the penile prosthesis reservoir was full, the right external iliac vein was being compressed, and this was demonstrated by showing an increase in flow in the external iliac vein at the level of the reservoir, as well as showing continuous flow distal to the reservoir in the external iliac vein, and also continuous flow in the common femoral and proximal femoral veins. Once the reservoir was evacuated, duplex demonstrated a decrease in flow, and some phasicity had started to be reestablished in the external iliac vein. Here are images of the right distal external iliac vein at the level of a full reservoir. The first one is demonstrating an increase in flow, and the second image is a color Doppler image demonstrating the compression of the distal external iliac vein. Here are images of, this first one is the common femoral vein demonstrating continuous flow, and this second image is of the proximal femoral vein demonstrating continuous flow. Shown here are images of the right distal external iliac vein with a full reservoir. The first is proximal to the reservoir. The middle image is at the level of the reservoir, and you can see from the first to the second image, there was an increase in flow at the level of a full reservoir, and then a distal to the reservoir with continuous flow. Next, we had the patient empty his reservoir, and then the same 3 images were obtained at the same locations. The first one, again, is proximal to an empty reservoir, and the middle image is at the level of the empty reservoir, and it shows a decrease in the flow compared to when it was full. And then at distal to, it's starting to be a little more phasic. So it was determined due to the compression of the inflatable penile prosthesis reservoir, a second revision needed to be made. The 3-piece penile prosthesis was decompressed. However, they were not able to remove it due to dense scarring and fibrosis surrounding. So they left the deflated prosthesis in place and implanted a new reservoir in the subrectus ectopic position. So in summary, color duplex imaging and spectral Doppler demonstrated compression of the external iliac vein when the inflatable penile prosthesis was inflated. This resulted in continuous flow distal to the reservoir and increased flow at the level of the reservoir. After reservoir deflation, it demonstrated a decrease in flow at the level and a slight return of phasicity distal to the reservoir. So it was also determined that the penile prosthesis placement location was actually the cause of the external iliac vein compression and also the cause of the patient's right lower extremity edema. Once the new inflatable penile prosthesis was placed in the subrectus space, the patient returned for a 2-week post-op visit, and his edema was completely resolved and his discomfort had been minimalized. Again, demonstrating that the penile prosthesis location was the cause for his external iliac vein compression. Thank you, and I hope you enjoy the rest of the conference.